Dr. Lindsey here. Wendy and I are going to talk about hairstyling before and after a selected surgical case, and a few issues that came up with this particular guy about my age who got 2,500 grafts up front. First off, when we have people come in, a lot of guys want to get a short haircut to help me out. Don't do that. Let your hair be as long and as bushy as you can. That lets you cover the scar in the back, lets you conceal anything we do up front or in your crown just by styling the hair, maybe putting a little topic in it, and it really lets you fly under the radar. For most guys, even if you just have a little bit of hair, you can style it and put some topic in it. So for our patients, don't get a haircut to help me out. Come in with long and bushy hair as long as you can, and then we can kind of blame any changes, or you can blame any changes on kind of a bad haircut.
A bad haircut, yeah.
And on this guy in particular, we had him come back. He came in for his scar check, I think a couple days early, and Wendy gave him a haircut, so you'll see him before and after the haircut. Wendy's a great hairstylist. She does my haircuts, and we pretty much, everybody gets the same haircut as me after a hair transplant. Also on this guy, you'll notice that his main, not complaint, but his main issue is redness in the recipient area, and that is normal. In fact, redness peaks generally around 6 to 8 weeks. That is a problem of real white people, like Wendy and the patient I show. People that are brown like me typically have just a little bit of redness, and people that are darker than me don't have really any redness, and it goes away. The converse of that, though, is that sun avoidance to the recipient area is key in brown people, because the pigment cells get revved up and can stain an area permanently brown. Somebody who's real white like Wendy or this guy, you get a sunburn afterwards, it's probably not going to do any damage other than give you a sunburn, which will go away. The next issue with this fella is he had almost no pain, and he's about my age, kind of a tough guy, tougher guy than me, and he says in here he took 3 Advil total. That's uncommon. Most guys, we do about 130 strips a year. The average guy takes 2 pain pills the afternoon of the surgery, 1 or 2 that night, 1 or 2 the next day, and then they typically take 1 the third day, and then admit they didn't really need it. They just took it because they were worried about getting to sleep. We have 1 or 2 guys a year that take almost no pain pills, like this fella. Now we have 1 or 2 guys a year that take all 20 Vicodins that we prescribe and ask for more. So it's a real spectrum, but a lot of my videos, I ask people how much it hurts, so you potential customers can really get an idea of how much it hurts just by looking at a bunch of my videos. Next issue is cleaning. This guy lives about an hour away, and he drove in here every day to get cleaned. And he was doing such a good job on day 4, I said to him, we'll see you on day 7, no point in you driving a couple hours for the next couple of days. And he dropped the ball. He essentially quit cleaning. Wendy says, where is this guy coming? And he didn't show.
He came from day 1 to 4. And then by the 4th time, we thought that he would get the hang of it and how we were cleaning it.
Yeah.
Because he looked good on the 4th one, at the 4th day. But then from 4 to 7 day, that's when it gets a little more crusty, and that's when you need to be a little bit more vigorous on scrubbing it, because he was afraid.
Yeah, and using conditioner and I try to beat it into everybody that cleaning is, if you live through the first night, cleaning is the way it's going to work or not. And this guy's highly educated and just wimped out on that. He was a tough guy on pain, wimped out on cleaning. You just can't do that. It probably won't cause any real problems, but you'll see in his 1 week pictures, he's just kind of crusty and scabby, looked kind of gross. So I yelled at him and told him to go home, and he put on some conditioner and let it soak, and the next day he drove back in here, and he looked fine. But you don't want to pull the crust out. You just want them to dissolve away.
Little by little.
And then lastly, when you look at his strip, even with the short haircuts, his strip scar, I mean, a guy like him who can have a haircut a ½ an inch long for the rest of his life, why in the world would he ever pick FUE over a strip? And not everybody can sew that well, and even when I sew really well, I get 4 crappy scars a year that are this wide, but a ½ inch haircut will always cover that at our office. And so he paid roughly $11,000 for 2,500 grafts, and he's got kind of skinny hair, and while I don't know it's going to work, statistically it's going to work sometime in the next 14 months. If he wanted to do FUE, we'd have charged him 20 grand, and we'd have put in more fragile grafts, and 13 or 14 or 15 months from now, he would look okay, but probably not great, and the whole back of his head would have been shot. It would look like he had, you know, a bunch of shotgun pellets hit there, which wouldn't cause any trouble if he's keeping his hair that length, unless he decides to do a second case, because then when you try to get a second case out of that shotgun-filled scalp, it's hard to get those hairs out, certainly by FUE, and by strip. Just the cutters always gripe more. They have a hard time getting the roots out without screwing them up. And we have a guy that coming up in the next 2 weeks that I'll do a video on, who went to Turkey. One of our 3 or 4 guys that have gone to Turkey, got a big FUE and had 4 or 5 hairs grow, and now he's coming in with a scar-filled head to get fixed. So, you know, the things to look at on this guy's video: the amount of pain he had, his cleaning, his scar, and kind of what to do as far as pre and post-op hairstyling. Hope you find this interesting.
About 3 weeks out, you did 25, just under 2,500.
Yep. Redness is normal.
Lean forward one time, maybe. There's this guy. How much pain did you have during the surgery? Or
Not
didn't have it the first couple days? Did it hurt a whole lot? Or?
No, I just used the apple, that was it.
That's
Once.
tougher than the average. And is it still numb where I'm banging on your head?
No, 50% kind of like below it's, I can feel it, higher I can't.
Yeah. So I took pictures of this guy a little bit ago, and he came in and we gave him a haircut and we gave him a mouse cut. And I tell everybody to grow their hair long. It gives you a lot of options. You can get a haircut in a month depending on how good your scar is. And his only real complaint that's expected is the redness up in the front. He's got a pretty short haircut now. And that scar, that's what it is.
Yes, that is.
It's hard to find that thing. And wife, do you think he looks better with this short haircut now?
Yes, I do.
Okay. As we were talking about, you could put some kind of tinted sunscreen on there, or just accept this redness, which peaks in about 6 weeks.